The question is, what's the difference between home care and group home, and what is the requirement for you to open at the current moment? What's required to open at the current moment depends on the state you're in. I'm going to answer the other question, which is the difference between group home and home care. Now, a home care is called something different in different states. For example, in California, they call it home care organization. In Virginia, they call it RSV. And in Minnesota, they call it home care. But then the home care itself, some states call home care more than one thing. For example, in Minnesota, we call it home care, but then it goes and further gets divided into two sections. So a home care is a non-medical personal support services. You provide support services by hiring a caregiver, a qualified caregiver, to provide daily living activities for people with disabilities, people recovering from illness, people who are in the elderlies, and anyone who cannot provide their own personal care. Okay, that is a home care. Again, if you take it apart, home care in some states, they they call it non-medical and home care medical. Home care medical means you provide skilled nursing services at the client's place of residency. You provide skilled services such as wound care, medication management, pain management, patient education, or anything that should be considered skilled and medical. Okay, home health. Think of the word health, meaning you're providing medical healthcare services by hiring an RN and an LPN, a physical therapist, occupational therapy, speech therapy, social worker, a home health aide, a CNA, medical doctors. All of those people who are working under this home health license are providing services that in nature skilled. Okay? So a home care, non-medical PCA, a home care medical is home health. Okay? Medical. The other question was, what's the difference, right? What's the difference between group home and home care? As I said previously, a group home is where you provide services in a residential facility. You go get a residential facility and provide services there. A residential facility could be a home or an apartment, depending on the regulation of your state. But the service that's getting delivered there is the same. You could be providing personal care, you could be providing health care. But where is the service being delivered? If the service is getting delivered in a home that you are controlling because you bought the home or because you leased the home, and you have more than two people living, well, I guess two people or more who are not related living in that home, getting services from you 24 hours most likely, then that's called a group home. Service is the same. It could be personal care or health care. So that is the difference between a home care, non-medical, a home care called home health medical, or a group home also called residential. If you're like lost of all the things I'm saying, you can book a meeting with me, and me and you will basically iron it out one on one. And by the time I'm done with you, you should have clear an understanding of what it is, what this is, and what business you should get into.